Good morning, good afternoon, good evening, colleagues, ladies and gentlemen. And as Lavinia mentioned, that we are working on this project in two parts, worker-based monitoring and community-based monitoring. So I'm sharing about our experience or work in this community. Next slide, please. So we started with the activities. It's outlined here. The community mapping to identify the community, sample collection, particularly for the contamination and contaminated site. CBM toolkits, it is an important toolkits for the community monitoring. And we have consulted with the community and the local authorities, national authorities, workers, and other professionals. And this is a process of continuous discussion meeting, and we have developed some information, education, and communication materials in this process. Next, please. Community mapping actually is an important part of this process. We are trying to identify, gain deeper understanding about the community and residents nearby the factories. And as you know that most of the workers are living in these communities around the factories. We are selecting 3 communities. Previously, our colleagues described the project location and activities. So this is the most important part of the activities. We try to mapping the whole community in the process. And the idea is to collect sample, identify the environmental impacts, health impacts, socioeconomic dynamics, and finalize for location of the sample collection. So in this process, we are working with, primarily we are selecting and discuss with the 5 international labs. They have the facilities to test the water, soil, and some cases, bio monitoring sample. So we have selected 2 labs primarily, and additionally 1 international labs, that is National Institute of Minamata Disease. And it is important to select this Minamata lab for the mercury analysis. And many of you already knows that the mercury is the huge body burden for the human beings. And that is why we are trying to see the scenarios of the mercury presence in the workers and the communities. And the Minamata lab is the only lab in Asia Pacific region to analyze the hair sampling for mercuries. So next slide. For soil sampling testing, you can see the pictures. We are collecting soil and water from the community around the 3 different communities, and you can see the situation of the canals situation. You can imagine the how horrible situation is around the community, and definitely it is a kind of reverse scenario about the worker-based to the community-based monitoring. So this is the real scenario, real situation of the community where the workers are living. And every day they're facing a lot of the problems, so that it is found that this project has the need to identify the contaminants and contaminated site and what are the impacts of the health and environment. So next slide, please. So after the collection of the samples, we have analyzed the 3 rounds of samples, and it is the process maintained with the international protocol. And we have collected sample in 3 different seasons: pre-monsoon, monsoon, and post-monsoon season. So that we can analyze, we can find that actual situation of the soil, water, and the air as well. So this is third round sampling collection is finished, and we have the primary result we have in our hand, and it is really alarming situation. So next slide. The lab analysis recorded the heavy metal and toxic chemicals found in the water and soil. And these are the toxic heavy metals and chemicals are determine the high level of exposure, and all the heavy metals and chemicals found the more accessible limit. This is a permissible, more than permissible limit. Most of the cases, I can example you the lead is the huge contaminant, and for the huge body burden, lead and cadmium. And generally, the permissible limit of the lead in soil is 0.01 ppm. But we found 114 ppm. Just you can imagine, this is heavy and high level, and same to the water as well. And the cadmium, chromium are the same. PFOS is a very high presence, and you know that PFOS is the mixture of different chemicals, and we have analyzed the 7 chemicals under the PFOS, and that 5 are detected high exposure in the water and soil as well. So we are still working on the mercury because the hair sampling is going on. This is a very comprehensive and technical methods. We are now preparing to collect the hair sampling from the community. As you know, this is some myth in our country that women are not ready to give their hair as sample. And so it is very difficult to convince them. And why we're collecting their sample, hair sampling. So, and somebody is asking, you are going to do this black magic. So it is very difficult situation. But finally, after last 4 months, we have struggling to convince the communities. And now we have get the consent of 31 community members, women's, they agree to give their sample. We will collect their sample end of this month, and then we'll send it to Minamata, Japan. And hopefully it will take some time. After 1.5 months, we will get the result. So this is the general situation that we found at the stage. And after compilation of the data, all the records, we will start preparing the report, and our colleagues from the health support, they will prepare the report, and hopefully we will compile the report and finish the report by the next 2.5 months. The next. And in this process, as already mentioned, that we have tried to engage all stakeholders in this process. So we have conducted the inception workshop. Inception workshop is always important in our context in Bangladesh to inform the local authorities, inform the national authorities, inform the workers, inform the stakeholders. So this is a kind of kick-off process to validate the project activities. So we have successfully validated our inception workshop with the highest level of participation from the government, labors, local communities, and other stakeholders. And still now, we have some difficulties, but we are getting a lot of support from all stakeholders in this process. Then next slide. And we have created the container group. The container group is an important part of this process. And we have selected the professionals group in this part. This is from the government, local government, labor union, local community. So it consists with the members from these different groups, and they are actually guiding and assist us to implement the process. So time to time, we sit together, we share our activities, and they suggest us, we keep it in the account of their suggestion, and time to time, we involve them in the field activities as well. And most of the cases, we get a lot of positive support from them. Next. This is another important issues that I mentioned, that the community-based monitoring toolkits. These toolkits we have adopted from international toolkits, and it is developed in the local language in Bangla. And this is an important part of this activities on this project. This toolkit will help to process, to identify, to monitor the health, environmental conditions, and how that can be improve the condition, and how we could link up with the facilities that already have provided by the local government and the national government. So this is an important, and these toolkits we have trained the community volunteers. Actually, they are implement these toolkits in their community. We select the young volunteers from the communities, both men and women. And this is the part of their training and capacity building process. And now we have selected 20 group of young men and women volunteers. They are now working in the community to use these toolkits. And this toolkits is guided clearly how they can collect information, how they can reporting mechanism, how they can identify the symptom of disease, and how they can monitor or indicate that their environment is going to contaminate it, the water is going to contaminate it, soil is going to contaminate it. The next slide, please.
Shadiad, 1 minute to wrap it up.
Yeah, sure.
Yeah, but it's so interesting. I'm really struggling to interrupt you.
Okay, no problem. Go back, please. Next slide. Next slide. Next one, please. So this is the final slide about the toolkits, and this toolkits is the chapter in different issues that we are highlighted. The impact of the hazardous chemicals, environment pollutions, human health, and food chains, how it is impacted, and the techniques, how they can collect a sample, what is the reporting mechanism, sampling mechanism, and also we are highlighted the regulations and the rules already exist and what are need to be improved, what need to be rectified. And the list of the symptoms, body burden is also created here. Finally, I wanted to say that we are in a very short time, it is very primary initiatives, and so we need to improve this situation together. I believe this is a serious issue, not only for the Bangladesh, for all developing countries. And if we could improve this situation, if we could make it happen as a model, that could be replicated around the world. I hope we will achieve our goal working together. Thank you very much.